Hi, this is another segment of Hudson Health. Good evening and happy holidays. We have the esteemed pleasure of having our Director of Health and Human Services, Stacey Flanagan, who's been under a lot of pressure, and we all should commend her for the amount of work that she's done in the last 9 months. It's been more than challenging for her. So thank you so much, Stacey. So there's a few questions that we had, and the first one was that I know you guys have done an excellent job. I, as a resident of Jersey City, have received my masks, which I thank you guys for. But what we want to know is that what is going to be the rollout scheme for Jersey City regarding the vaccines and all this other stuff?
Oh, great. Well, I don't know exactly when this goes live, but while we're speaking, the first round of individuals are getting their vaccines across 6 hospitals in the state of New Jersey. We have a plan in Jersey City that the mayor's ready to announce. We are trying to make sure that we have a location in every community. We're looking to open 6 point of distribution centers for vaccines. The goal from the state is to reach about 70% of the adult population of our city over the next 6 months. We anticipate working very closely with our federally qualified health centers and our hospitals. So our hospitals are getting the vaccine first. They're going to be doing their own staff and the affiliated staff first. We're working with the county on healthcare workers across the county. The state is working with Walgreens and CVS for nursing homes and nursing home staff. And we're going to be working with partners to make sure that we have open sites available to the residents and education in all the languages that our community speaks. We'll have a medic on call for any concerns post the required 15 minutes to sit after your vaccine. And then we will start a follow-up for the 28 days. We're presuming to get the Moderna here in Jersey City. Excellent. And we are trying really hard to make sure that we are on point with the refrigeration in every location, because some of our pod locations are city buildings, some are possible county buildings, school buildings, and so we're going to be in 6 different public buildings that are fairly accessible, and we want to make sure that we combat the fear, start educating on, how can we help people break down that barrier, and then the follow-up in case people after their first vaccine shot gets ill and then have greater fear of returning for the second.
So and I think that's the biggest problem we're having as well as physicians in the community is the educational piece. They have questions, they want to get involved. I have some patients that are calling to make appointments for the vaccine when it's not even here. And then we have patients who don't want to have anything to do with the vaccine. So my biggest concern is getting that educational piece out to our community.
So we started this week, our staff is doing small workshops for the whole department. So we're first training our other teams. So, we have a really comprehensive department here. So we don't just handle health, we do health and human services. So we have a whole, group that deals with veterans, a team of division for immigrants, a division for seniors. And we know that those are specific targeted populations that are going to have a lot of different questions, and that we need to make sure that we have the right answers. Like, can I go to my VA hospital, or do I have to wait in this line, or is there veteran preference? And so there's a lot of things that we still don't know. But we also know that seniors are having, more difficulty leaving the home because there's a lot of concern and would prefer us to show up at their door like we've been doing for COVID testing. This is a little bit more complex. And anywhere where we can accommodate things like that, we're going to try to. We know that both hospitals have been really incredible support for us, and we're going to lean on, how we can help support them to do some more public work. So, possibly Greenville and adding locations downtown. We have some locations that are pretty standard health department locations. So, we expect that will be in our building up in the Heights. It's completely empty right now. In fact, we gave up some space and made a food pantry
Stacey,
there
we're going to take a short break, and we'll reconnect in a few seconds. Thank you.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go? Go to the App Store, download the TeleMed app from RWJ Barnabas Health, and you see the doctor right away. From any mobile device. Whenever you want, wherever you are.
Quality care. No appointment necessary. The doctor is online when you download the TeleMed app.
Don't you feel better already?
RWJ Barnabas Health. Let's be healthy together.
Welcome back to Hudson Health. We're here with the esteemed honor of having Stacey Flanagan, the Director of Health and Human Services. And we're just going to talk about a few more topics, including COVID testing.
I think you guys have done a great job under Phillips' administration, Stacey, by just having strategically placed these COVID mobile units all over Jersey City. The accessibility is great, the turnaround's great, and the fact that they're there to educate the people that are getting tested is great. So I want to thank you, and I want you to tell everybody, the audience, of where it's situated and how they can go in and how easy it really is.
Yeah, so, in the beginning, we couldn't get access to a significant number of tests, so we only had 2 sites, and those sites were paid for directly by the city, and we wound up getting that money reimbursed by CARES. We only have 1 site that we paid direct, and so we often push people to Marin because there weren't a lot of places doing testing. Now, the CARES Act allows for insurance to pay 100% of testing. And so many providers have offered to forego accepting payment for anyone who doesn't have insurance. And we started pulling in mobile units and working with different partners. So we have about 7 different labs working in partnership across the city. I believe we have 17 different locations now. 2 are run directly by the New Jersey Department of Health's team. One is a Binex Now rapid test in partnership with the United Way. And one is the saliva, the Abbott Lab, Rutgers test that we're doing at the Bethune Center. And those are really rather quick tests. So the rapid is 15 minutes. The saliva, we issued some yesterday. People got their results within 10 hours. So
wow.
We know that those are even, incredibly quick, and we use them here at the city when we see something happening, and we're working with the community because they're self-administered. So you just need a cell phone, someone to hand you a test. You can handle it yourself, put it into the bag, and we drop it off in Piscataway. So that's really quick, and the lab is local. Then we have some partners. We've had some councilmen and some freeholders. So in the beginning, freeholder Walker came to us and said, I want to do testing in my community. He connected us with a partnership, and they came to do some tests in the park across from Team Walker. And then now Freeholder O'Day, who's I think they're rolling out now to everyday testing in the South Hudson Civic Association site at Westside Avenue. That lab is Fusion Labs. They're doing an incredible job, and they're working with the all the local construction sites and those unions around the trades to make sure that they're getting on-site testing. So that's something really cool that we just developed with lots of partners. And so anywhere we can engage someone to say, it's time, because many people weren't doing testing in the beginning. So we have about 5 sites that are appointment only, and the other 12 sites are first come, first serve. And
we know that you're doing
the
best job, because if you look at the hospitals in Bergen County, they're packed. And in Jersey City, they're still okay. We're doing pretty good. I mean, I think we've done a good job with getting the word out, especially with the masks. And I know for sure that the mask use is going to decrease the transmission of influenza as well. So I think it's a win-win for all of us.
I do too, and I think you both know, because you're, the physicians actually in the front line with the individuals that are coming to you sick and don't really know what to do. And I think we've also trained people a little bit more on when to go to the hospital. It's better you stay at home for a few days, really understand what your body's doing, make sure you're getting enough liquids. But if you feel something around your breath that's not right, don't take that extra trip, because you can only, get exposed to something else if you're, not have COVID. That actually was my fear most of the time. I was in this office and I was like, I'm not getting enough water. I'm having stomach pain. What's going on with me?
I agree with you 100%. I mean, at this point, I was just counting the number of COVID patients I have that I'm treating at home, and I have about 22 patients. Some are bad, some are okay, some are totally asymptomatic. But I think that educational piece is extremely important, and just, giving that reassurance to the patients that you're okay. Don't go to the hospital if you don't need to, but yes, there is a point where you do go to the hospital where you can't breathe and you have a shortness of breath and you have other issues, because we don't want to tax our hospital system either. The good thing is that they're managing it very well in the hospital. The patients are being discharged healthy, but are there deaths happening? Yes, absolutely. They're continuing to, die. I think New Jersey lost 97 patients today, to COVID. So we still need to be very vigilant on this.
I think across the board, and something that I found rather interesting is, I look at the numbers every morning from both hospitals in Jersey City, and they both pull from other cities too. So, Christ has people coming in from Union City, North Bergen, Hoboken, and Jersey City Medical Center. Some people, from Bayonne. And so we don't have an accurate, how many are residents that are in the hospital. But the hospitals have been very on top of kind of figuring out, how can we work better together. Once we figured that out in the very beginning about giving us the data, making sure that we know how many ventilators you have, what you might need, how we can coordinate, we started stockpiling. So our Office of Emergency Management has actually been incredible during this. And we couldn't do this without fire, police, the innovation team. We had a lot of people helping the Department of Health and Human Services get through this, because what we saw, and I think is another major discussion to have, is the economic fallout on the other side that's also impacting health. And some of that is the food insecurity in our community, and the decisions that families are making. in feeding their families. And so we saw our Meals on Wheels triple over the last 9 months. We're delivering food to hundreds of families on a weekly basis that are just impacted by COVID. We saw a lot of immigrant families in the beginning because they didn't qualify for unemployment or didn't get benefits in the traditional way of food stamps and stuff like that. And so we've seen such a stark increase there. And we started seeing families stop going to pick up the school food. And so we had to really work around that, and we created a food security task force with partners across the whole city and some across the county to move food rather quickly, and spent a lot of money kind of supplying farmers markets and then local restaurants so that we can deliver meals with partners like Logisticare and Via. It's been really amazing what we were able to do in a short period of time to move lots of food. So we saw that it was really important that people got fresh food because a lot of people were getting a lot of canned and a lot of things from the pantry setting that wasn't fresh. And so we really focused on that majority during the summer. But now when we deliver to people's homes, we make sure that at least one of the boxes of food that we deliver is all fresh fruits and vegetables.
Wow. So you have such a multifaceted job. God bless you. Thank you so much, Stacey, for everything
and I don't
you
even talk about
and
animal
you're
control
doing.
because that's very
Thank you
difficult
so much.
during
Thank you.
time, too.
God bless you. We
Thank
wish
you
you
so much.
whatever we can do to help. Please let us know.
Absolutely.
All right. Thank you so much
Will
for coming
do.
on the show.
You're amazing.
All right,
Thank you
we'll
so
send
much.
you over some maps so you can hand them out to some people in your network as well.
That would be great.
Thank you so much,
Thank you
Stacey.
so much, Stacey.
Have a good evening.
Take care.
Bye.
Happy holidays.
Happy holidays.
You too.
Stevens Jersey City Ford, located right off of NJ 440 North. Across the Hudson Mall is your one-stop for all your automotive needs. Check out Ford's latest models like the 2020 Ford Fusion with its stylish looks and hybrid options, or the unparalleled high-performance 2020 Ford Mustang. The 2020 Ford F-150 Raptor is ready for those rugged off-road terrains with trail control. Need a mid-sized truck for your towing and hauling? The 2020 Ford Ranger will deliver. The 2020 Ford Escape is a luxury SUV that was made for comfort and adventure on the go. Returning is Ford's legendary Bronco, which takes you back to the true meaning of off-roading. They are now available for pre-order in our showroom or on our website. Let us help you find your next vehicle. Stevens Jersey City Ford, 201-432-7272.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hi, welcome back to our segment for Hudson Health. My name is Dr. Amir Syed. Here accompanied with my co-host, Dr. Sakiba Syed. And we're just going to follow up on things that we discussed with the Director of Health and Human Services, Stacey Flanagan. And she brought up a lot of good points, and she brought up the fact that how accessible it's becoming to get COVID tested. So what we want to recommend is that, take advantage of these. They're free. It's free to get tested. Insurances are covering it. Everybody's covering it. Okay, the fact that you shouldn't have to pay to get COVID tested. There's multiple mobile unit sites that are available, and the turnaround test period is very good. And like you said, at the Mary Bethune Center, you can get results within 10 hours. It's a saliva test that Rutgers started. I got it done, and I think it's a very good thing for the community to know about, because the earlier you know about it, the earlier you can notify your physician, and they can treat you for it at home instead of you going to the hospital. The second thing we want to highlight is that don't let this corona affect or delay the treatment of care. That's very important for you guys to know that. It's if you have ongoing cancer treatment going on, or you have a procedure scheduled, or anything of the sort, the hospitals are very, very, very well disconnected. So you have your COVID wings, and then you have all the other services that are completely available. So please don't delay, because that could be catastrophic.
Where you can get COVID is going to these gatherings, going to Walmart, going to shopping centers, these malls, without proper mask wearing techniques, without, managing your social distancing. That's where the threat of COVID is. And I think it's extremely important for the community to understand the more we get tested, the more we know who's infected and who's not, the better we are in maintaining the safety of the community. The earlier you let your physician know, and like I told Stacey, I have 22 patients that I'm treating at home at this point, and they are well. Some are sick, some are okay, and some are asymptomatic.
And the Thanksgiving surge is being apparent now, and you can see the numbers going up. So I know it's a very difficult time for all of us together, but please limit your gatherings to your bubble. It's very, very important for you to know that. And please try to avoid travel. We're almost there. There's light at the end of the tunnel, even though it's a long tunnel, but I think the vaccine rollout is going to be very, very good. We have the Moderna vaccine, just like Stacey was saying, that's coming out. That'll be more accessible in doctors' offices, and it'll be widespread. So please do yourself a favor. Limit your gatherings, especially the indoor gatherings. Wash your hands very, very well, 20 seconds. Any soap is fine. A lot of people have questions about, should I use antibacterial soap, or no, any soap is fine. It's a very, what we call lipophilic virus. So it dies with contact with soap and water. Wear your masks and limit your gatherings, please.
And I was looking at the Jersey City website, the City of Jersey City website. It's extremely informative. You have that website online, and I think everybody should visit it. They have great information, great services that are available to the community, and they have a number where you can call if you have symptoms and your doctor is not available, or you don't feel comfortable calling anybody else. There is a phone number that the city will answer, and they are trained health professionals that will guide you on what to do. So I went through that website yesterday, and I was pretty much, in awe on how well orchestrated it is and how well put together it is.
They've done a great job.
They've done a great job.
They really have. I personally want to thank Mayor Fulop, Stacey Flanagan, their entire team.
Absolutely.
Mayor Sacco, Mayor Stack, for all the efforts that all the Hudson County mayors have done to come together collectively to take care of this. Thank you so much, and we wish to see you again for another segment for Hudson Health.
Pan & Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panandpintoproperties.com. Pan & Pinto Properties, building Jersey City for everyone. Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Welcome back to Hudson Health. I'm Dr. Syed. I'm accompanied by my sister, Dr. Syed, as well. And now we're just going to touch upon some topics regarding the vaccine. Right now, there's 2 vaccines that have been approved for emergency use by the FDA. First one was the Pfizer vaccine. Today, New Jersey was the first state patient to get it. It was a nurse, a critical care nurse at NJ, and we're proud to say that she got it, and
I think it was
her
birthday
birthday as well today too. So it's a big deal, and God bless her soul. We wish her well. But we just want to talk about the different vaccines that are available and that are coming up, and what you can expect and when you can expect it.
So we have the Pfizer vaccine, which was approved about a few days ago, and Moderna's approved as of today, and we should start receiving shipments probably by next week. These vaccines are 94.5 to 95% effective, and the Pfizer vaccine is 2 doses, and so is the Moderna. The Pfizer vaccine is 21 days apart. The Moderna vaccine is 28 days apart. It's important to understand you must get both doses, and there are going to be side effects. Side effects are minimal, so, just like with any vaccine, because it's recruiting and boosting your own immune system to become stronger to fight off this infection if it's ever exposed to it. Common side effects are injection site pain, fatigue, malaise, flu-like symptoms, very small, very transient. They have data for the past 2 months on people who have gotten the vaccine in the phase 3 trial, and there were not any significant issues at all. So I think that's reassurance. I think it's extremely important that we understand that at least 70% of the population needs to get vaccinated, and it's when they get vaccinated we'll attain that herd immunity to prevent the transmission and progression of this disease. The fact that today was the first day that we got the vaccine into our community is I think that's light at the end of the tunnel.
Absolutely. We both we were both trained at St. Michael's Medical Center in Newark, New Jersey, which is a very, very big infectious disease hospital, and with the honor of being trained under Dr. Leon Smith, who's one of the greats in ID throughout the country. He was very good friends with Dr. Fauci, by the way, who had the honor of meeting 2 times at St. Michael's. A lot of questions that are being asked by my patients are like, can I get the virus if I get the vaccine? Remember, this is just a piece of the virus particle. It's not a live virus. So no, you cannot get infected, but it can prevent you getting the virus by 95%. And even those people who do get the virus, they don't develop complications from the virus. So in other words, if you get the vaccine, your chance of getting hospitalized are only 5%, which is amazing. In the Moderna vaccine, actually, they showed that nobody got hospitalized. So I think this is very important for you guys to know. And hopefully we're looking at around, I would say mid-March to April, where we'll be able to get a lot. And the more people that get it, we'll have a great end of the summer and look forward to a great, great, great fall. But please wear your masks, wash your hands, and keep yourself socially distant for now. And then, God willing, at the end of the summer, we should be looking good. We should be looking forward to a good fall. And next year's Thanksgiving and next year's Christmas is going to be very different.
Absolutely, and I really want to emphasize that it's important to ask questions. Ask questions. It's okay. We might not have answers to those questions, but we'll find out. No question is stupid. No question is, something that you might be asking a question that represents maybe 50% of the people who want to know the answer to. I might want to know the answer to. Just ask questions. This is a learning process, and we're all in this together.
So thank you so much for joining us again today, and we look forward to speaking to you again, and we'll give you some more updates coming up. Thank you so much. Have a good evening.
Thank you.
Happy
Good
holidays.
evening.